Over a year after the COVID-19 pandemic began, we've come a long way, but the numbers remain worrisome. In an effort to offset a rise in cases, the White House plans to offer COVID-19 booster shots to vaccinated adults. Here's everything we know about them. There is a good chance that you have some passing familiarity with the notion of booster shots. That's because 50 out of 50 states require students to get vaccinated before they start school, and many common childhood vaccines require boosters, like the MMR and Tdap. A booster shot is a subsequent shot of any given vaccine that requires it, at some interval after the original vaccine was given. Booster shots, like vaccines in general, are part of routine healthcare in the U.S., according to the CDC's recommended vaccine schedule. In fact, sometime in the last 10 years, it's likely your primary care physician or physician's assistant recommended that you get a tetanus booster. Why? Because tetanus can kill you, and in order to remain immune to it, your body needs a booster shot every 10 years. The bottom line is that some vaccinations require a booster in the form of a subsequent dose of the same vaccine to remain effective as time goes on. However, the reason some vaccines decrease in effectiveness over time is considered an unsolved medical mystery at this point. What is known, though, is that unlike the initial vaccine, a booster does not teach your immune system how to respond when faced with the virus in question, but rather reminds your immune system how to respond. From even before the COVID-19 vaccine rollout in the United States, scientists in this country and around the world have been following the data as it comes out, both regarding the performance and risks associated with the COVID-19 vaccines authorized by the FDA. Thus far, it's been observed that these vaccines are continuing to protect people from severe COVID-19 and death from the virus. However, scientific studies have indicated that the strength of all such vaccines may be waning over time. This leaves the currently fully vaccinated population open to contracting COVID-19 with mild or moderate symptoms. Additionally, the White House has said that the strength and contagiousness of the Delta variant increases the need for a booster.
COVID-19 booster shots are coming.
This means that an increasing number of vaccinated people may be or may become increasingly vulnerable to contracting COVID-19, many without realizing it due to their mild to moderate symptoms, and they, in turn, can then spread COVID-19 to others, both vaccinated and unvaccinated. In fact, the available data has now made clear this is what's happening. A number of other countries, including Israel, France, and Germany, are already offering or planning on offering booster shots of their existing COVID-19 vaccines. Other health organizations around the world are also moving in that direction. U.S. officials announced August 18th that they have concluded that a booster shot will be needed.
It is now our clinical judgment that the time to lay out a plan for COVID-19 boosters is now.
Prior to the White House announcing plans to roll out COVID-19 booster shots, the CDC had expressed concern about the COVID-19 vaccines potentially not providing the same level of immunity to the immunocompromised population as they do for the general population. This is not strictly a COVID-19 specific phenomenon, but rather something that is seen in the field of vaccinations in general with regard to people with weakened immune systems. Further, data released by the CDC suggest that 44% of breakthrough cases of COVID-19, cases that occur after full vaccination, are occurring in immunocompromised people. This is a concern both to such people and also anyone with whom they come into contact. Accordingly, the CDC has been recommending that people whose immune systems are compromised receive an additional dose of the Pfizer or Moderna COVID-19 vaccine they'd already received.
Is that third shot we've seen from CDC data will mount that effective immune response up to 50%.
While this might seem like a booster shot, the CDC clarified, this additional dose intended to improve immunocompromised people's response to their initial vaccine series is not the same as a booster dose given to people when the immune response to a primary vaccine series is likely to have waned over time. That might sound like splitting hairs, but the point the CDC is making is that discussions regarding booster shots are separate from discussions regarding additional doses for the immunocompromised. Booster shots will first be made available to those who were vaccinated earliest, including healthcare providers, long-term care facility residents, and senior citizens. Due to the decreasing vaccine effectiveness that happens with time, this prioritization makes sense. In addition, this plan also takes into account the risk the virus poses to them as a result of prolonged exposure, as well as factors such as age and infirmity, according to the CDC. Like the initial COVID-19 vaccines, they will be offered free of charge, according to the Wall Street Journal. The joint statement of medical experts and the U.S. Department of Health and Human Services said, Our top priority remains staying ahead of the virus and protecting the American people from COVID-19 with safe, effective, and long-lasting vaccines, especially in the context of a constantly changing virus and epidemiologic landscape. The plan is to begin offering booster shots in fall 2021, although this plan is subject to the Food and Drug Administration's evaluation of how safe and effective a third dose of the Pfizer and Moderna vaccines are. The CDC's Advisory Committee on Immunization Practices also must issue booster dose recommendations based on their review of the evidence. Assuming these contingencies fall into place as expected, the Department of Health and Human Services plans to offer booster shots to all fully vaccinated Americans starting on September 20th. Those who contributed to this statement include CDC Director Dr. Rochelle Walensky, Acting Commissioner of the FDA Dr. Janet Woodcock, U.S. Surgeon General Dr. Vivek Murthy, Director of the National Institutes of Health Dr. Francis Collins, and Chief Medical Advisor to the President Dr. Anthony Fauci. According to the joint statement, once booster shots roll out in September, they will likely be offered to all Americans beginning 8 months after a person's second dose.
Just show your vaccination card and you'll get a booster.
It should be noted, however, that these plans are with regard to those who had either the Pfizer or Moderna vaccines. The statement went on to say that booster shots likely will also be needed for people who received the single-dose Johnson & Johnson vaccine. However, in light of the fact that the U.S. did not begin administering the Johnson & Johnson vaccine until March 2021, there is not yet sufficient data to determine the need for a booster. U.S. Surgeon General Vivek Murthy said in a White House press briefing the same day, "I want to be very clear. This plan is pending the FDA conducting an independent evaluation of the safety and effectiveness of a third dose of the Pfizer and Moderna mRNA vaccines and the CDC's Advisory Committee on Immunization Practices issuing booster dose recommendations based on a thorough review of the evidence." According to Murthy, experts are analyzing the continuing effectiveness of the Moderna vaccine as well as the other FDA-authorized vaccines. Thus far, the analyses indicate that the Moderna vaccine's effectiveness has indeed been declining over time. The Mayo Clinic's analysis indicated that the Moderna vaccine's effectiveness has declined from 86% to 76% as of July 16th. This can be considered significant, particularly when considered in light of the fact that the overall effectiveness of all FDA-authorized COVID-19 vaccines has declined to 53% as of August 2021. The bottom line is that if you received the Moderna vaccine, your body's ability to protect itself when exposed to the coronavirus responsible for COVID-19 may already be declining. This puts you at a greater risk for mild to moderate breakthrough infection with COVID-19, which can also make you contagious to others, including the unvaccinated. Fortunately, Moderna has been testing its booster vaccines in already vaccinated individuals, according to CNBC. The results indicate that the Moderna booster produces a, quote, promising immune response against COVID-19, including the Delta variant, and with risks that do not seem to outweigh these benefits, CNBC reported. Data from the Mayo Clinic regarding the continuing effectiveness of the Pfizer vaccine may be somewhat more disconcerting than comparable data regarding the Moderna vaccine, according to the White House. Such data, which was culled with respect to 80,000 vaccinated and unvaccinated individuals, demonstrates that as of July 16th, the Pfizer vaccine's effectiveness against infection declined over time from 76% to 42%. In addition, separate research conducted in Israel shows that the Pfizer vaccine has been becoming less effective at preventing both infection and the spread of COVID-19 over time, especially in light of the emergence of the particularly contagious Delta variant, according to Reuters. As with the Moderna vaccine, anyone who received the Pfizer vaccine may become more vulnerable to COVID-19 infection over time, putting them at risk for contracting mild to moderate COVID-19 and spreading COVID-19 to others. Pfizer has committed to providing the U.S. with 200 million additional doses of its vaccine from October through April 2022, according to the Wall Street Journal. The decision to move ahead with a Pfizer COVID-19 booster shot marks a reversal from the FDA's decision from just a few weeks prior that boosters would not be needed, NPR reported. The Johnson & Johnson COVID-19 vaccine presents its own unique challenges in terms of getting a booster program rolling. One reason is that the vaccine was not available to the general public in the U.S. until March 2021. In addition, the Johnson & Johnson vaccine is distinguishable from the Moderna and Pfizer vaccines in that it was designed as a one-dose protocol and is not an mRNA vaccine. However, U.S. Surgeon General Vivek Murthy revealed during the August 18th White House press briefing that he anticipates Johnson & Johnson booster shots, like Moderna and Pfizer booster shots, will become necessary, saying, "We expect more data on J&J in the next few weeks." As the information comes in regarding the Johnson & Johnson vaccine's continuing effectiveness and the safety and efficacy of a booster, the White House has pledged to keep the general public informed as to whether a J&J booster will be made available. The prevailing wisdom with regard to mixing and matching COVID-19 vaccines in general has been that individuals should stick with whatever vaccine they have gotten previously for COVID-19. In other words, if your first dose was of the Moderna vaccine, then your subsequent doses should likewise be of the Moderna vaccine. However, this may be changing, according to NPR, which pointed out that using two different vaccines against the same viral threat is not a new concept. It's known as heterologous vaccination. One example is the polio vaccine. The benefits of heterological vaccination are both scientific and practical. Regarding the latter, remember how in the first few months of the COVID-19 vaccine rollout, you had little to no choice in which vaccine you would receive? Heterological vaccination means that people will be able to get their booster regardless of whether their local vaccine center is offering boosters of the vaccine they received initially. Immunologist Helen Fletcher told NPR, "If you give two different types of vaccine, then you tend to get a better immune response than if you give the same vaccine twice." Although the CDC has, as of this video, yet to address choosing a different booster from your original vaccine, they did address mixing and matching third doses among the immunocompromised, stating, "For people who received either Pfizer-BioNTech or Moderna's COVID-19 vaccine series, a third dose of the same mRNA vaccine should be used." Something of concern to many is the risk of side effects with booster shots. And as the second dose of the mRNA vaccines were often accompanied by more side effects compared to the first doses, it is something experts are considering. Jay Butler, deputy director at the U.S. Centers for Disease Control and Prevention, said during a press briefing, "We're keenly interested in knowing whether or not a third dose may be associated with any higher risk of adverse reactions, particularly some of those more severe, although very rare, side effects." And for recipients of the Johnson & Johnson vaccine, an mRNA booster shot could produce a different set of side effects from what they experienced when they got their initial shot, Dr. Wen explained to CNBC. That being said, more information about the side effects associated with mRNA boosters will become available as more people volunteer to receive booster shots around the world. For example, some countries, including Germany and the UK, are already giving mRNA boosters to people who received the AstraZeneca vaccine. And according to CNBC, this protocol appears to be, quote, working well with few side effects. And right here in this country, in San Francisco, California, Johnson & Johnson vaccine recipients are already eligible to request and receive a supplemental dose of one of the two mRNA vaccines. Rest assured that as more data becomes available, more and more information will become available too. Check out one of our newest videos right here. Plus, even more Health Digest videos about the latest vaccine updates are coming soon. Subscribe to our YouTube channel and hit the bell so you don't miss a single one.